So we need disease-specific quality health registries in healthcare to allow us to report and analyse data for the subjects, the patients with conditions across the healthcare system. It's really important to capture that data so that we can report back on prevalences of conditions and how well conditions are being monitored and controlled, so that we can then use that information to make improvements as we move forward. So everybody involved with the healthcare service could potentially have benefit from systems like these. Ultimately, the patients will get benefit because if there's appropriate reports made on the information that's collected, then they will benefit by improved services. The healthcare team will hopefully benefit by having more information about their current practice and how they can perhaps target areas that require improvement. This is particularly important when you're comparing across regional areas, for example, where you might notice differences between quality levels of care. Ultimately, it will also affect or impact the people who are funding the health services. So it's important that they have the information that they need to target appropriate resource to the healthcare system to ultimately improve things for the benefit of the individual patients. I think one of the most important things to consider for systems like these are the quality of the data and the completeness of the data. There's obviously certain things that you'll want to report in terms of performance indicators, so you want to make sure that the data that you use to report these indicators is consistent, it's recorded in a very similar way. You have things like coding systems that are used appropriately, and you have that individual structured data that you can then use to more effectively report information on the conditions that you want to monitor. I would say, as you're starting out, don't try to do everything all at once. I think if you identify key conditions, which I know you have done, try to identify individual performance indicators that you want to monitor. Pick maybe 2 or 3 of those, try to do them very well, prove the concept, and then once people have actually become more familiar with how things will operate, they will buy into it, and then you can gradually expand the process over the course of time.